Good afternoon, and thank you for joining us. Today we'll be providing you an update on the investigation of the 2019 novel coronavirus, now being referred to as COVID-19, and our efforts to prepare in the event of a COVID-19 pandemic. Just a reminder to maintain quality audio. Please keep your phones on mute until it's time to ask your questions. We will take your questions in the order you RSVP'd, and also a reminder that a video of the briefing will be available for your use later this afternoon. Joining us for today's briefing are Chuck Warzeka, the Deputy Administrator of the DHS Division of Public Health, Dr. Ryan Westergaard, a Chief Medical Officer with the Bureau of Communicable Disease, and Jeff Phillips, the Director of the Office of Preparedness and Emergency Healthcare. We'll begin the briefing with remarks from DPH Deputy Administrator Chuck Warzeka.
Thank you. Good afternoon, and thank you for joining us today to answer your questions about the 2019 novel coronavirus, or COVID-19. We're also going to share information about the current status of this disease and what the state of Wisconsin is doing to prepare for in the event of an epidemic. First, we want to update you on where we are at today. There are currently a total of 17 people who have been under investigation for this illness. Of those, 15 tests have come back negative. 1 is still pending, and 1 has been confirmed. The immediate health risk to the general public in Wisconsin and the United States as a whole remains low. The risk of getting COVID-19 still involves travel to areas where the spread is active, as well as contact with people known to have the virus. Everyone can do their part to prevent the spread of COVID-19. CDC has travel guidance on their website that they update as things evolve globally, and that's updating quite frequently these days. And to maybe give us a little bit more of an update on the status of this outbreak globally, I'll turn it over to Dr. Ryan Westergaard for a summary of where we are now.
Sure, thank you, Chuck. I'd like to reiterate the message that here in Wisconsin, the status of the epidemic of COVID-19 remains one where the risk of the population is very low. Now, things are changing globally because of an increased number of countries where there seems to be person-to-person spread. And that has made the overall probability that eventually in the coming weeks or months there will be more widespread transmission in the U.S., it's made that probability higher. So that's one thing that we've learned, and I think our federal partners at CDC have changed their posture somewhat to encourage us to shift to the phase of being prepared to mitigate outbreaks of this respiratory virus in communities. What hasn't really changed, and actually what we've gotten somewhat more clarity on, is that the level of risk to individuals who become infected seems to be a little lower than initially reported. As more data have been collected, the mortality rate estimate seems to have become lower to less than 1%. So that's good news in that the virus itself seems to be less lethal, but the degree to which the infection is spreading through communities is at a higher degree than it was 1 or 2 weeks ago. So that's really the message, is that the immediate risk to communities has not changed in Wisconsin. We don't believe it's spreading currently, but our efforts are really increasingly focused on how can we prepare for the eventuality that it will in the future, and I think that's what we're here to talk more about today.
Okay, and then to explain a little bit more about what we do to prepare for things like this, we've got Jeff Phillips here, Director of our Office of Preparedness and Emergency Healthcare.
Great, thanks, Chuck, and good afternoon. I really appreciate the opportunity to talk about the role that our office has within the Division of Public Health. The Office of Preparedness and Emergency Healthcare is really responsible for supporting public health and hospital preparedness. Our job is to support and enhance the capacity of state, tribal, and local health departments, as well as the healthcare system, to prepare for public health threats and emergencies through planning, exercising, responding, and training. And of course, this includes preparing for pandemics. We also coordinate with the CDC and other federal partners on the National Strategic Stockpile. So what does preparedness mean, and specifically for something like pandemic, or in this case, COVID-19? We're currently working with CDC and our local healthcare partners to understand surges in demand and the usage of medical care and supplies. We conduct extensive outreach to healthcare organizations to ensure that their systems are prepared to handle a pandemic. We work very closely with healthcare facilities to reinforce infection control principles, recognizing that personal protective equipment is one component of a larger set of practices that can help to limit the spread of disease. We are working with the CDC and their development of a large range of strategies to conserve respirators in order to make those supplies last longer. We're investigating whether or not telehealth tools can be utilized to help direct people to the right level of care for their medical needs and to possibly treat people remotely depending on their medical needs. We're looking to disseminate guidance that helps to the public and private sectors ensure that they are able to operate with adaptations like telework and flexible leave policies, as well as to respond properly when an employee does get sick. We're looking at developing guidance for schools, childcare programs, colleges, and universities to help them plan and prepare for pandemics. We're working with educating communities and families about non-pharmaceutical interventions that can help to slow the spread of illness, and in this case, COVID-19. While there's no treatment available, we would be using these types of treatments to limit community spread. So what would that look like? We would look at home isolation or staying home when you're sick. We'd look at quarantine, covering your coughs and sneezes, washing your hands, routine surface cleaning of frequently used surfaces, school closures, dismissals possibly, mass gathering modifications or postponements, and then other social distancing measures that would be things like offering telecommuting in workplaces, remote classes at the universities, and social distancing in congregate settings. So with that, that gives you a little bit of background as to what the Office of Preparedness and Emergency Healthcare will be working on.
Okay, thank you. And with that, we will open it up for questions. Just a reminder to mute your phone if you're not asking a question, and of course, unmute it when you are to maintain our audio quality. And we'll begin the questions with Mason Dowling of WAOW TV in Wausau. Mason? Mason Dowling from WAOW. And a reminder to press star.
Can you hear me?
Yes, we can. Thank you.
Okay. There we go. Sorry about that. I was hitting the, pound instead of star. Yeah, this is Mason Dowling with WAOW. I just had a quick question for the team. I noticed that the word pandemic or epidemic is being thrown around a lot on the national scale, and even you guys are using it here in your talks. Is this really something that we are starting to consider that may be a pandemic, or is this getting a lot of blown out of proportion?
Brian, would you like to?
Sure, I'll take it. It's a good question because it's definitely a term that grabs people attention, and the official label of what is a pandemic comes from the World Health Organization, and they make their decision about making that declaration based on a number of factors that aren't really fixed. There's not a standard definition. It has to do with several elements, including sustained transmission in a number of different areas of the globe, different regions simultaneously, beyond what's normally expected. So there's not a specific threshold that gets crossed, and the decision to declare something a pandemic is really made strategically about communicating with the public as much as it is sort of defining the scope or the severity. So at this point, when they looked at all the up-to-date, they declined to make that declaration as of a few days ago, but I think that decision is in flux. So I guess the message in Wisconsin is that is a term that's supposed to be useful to understand the general scope of the global problem, but it doesn't really change how concerned typical citizens should be. That really is going to come from what we learn about how the disease is spreading individually in individual communities, and we use the data from testing and hospitals that we have there. And right now, like we've said, that there's not active transmission here in North America, frankly. But the WHO determination of declaring something a pandemic really sort of is intended to give us a sense for how urgent or how imminent might that be.
Mason.
Okay, thank you. Do I get a follow-up or no?
Yes.
Okay, just one quick follow-up would be, how has, given that now we've had a couple months to really study it, how is COVID-19 shaping up compared to a normal annual respiratory disease? You know, is there anything specific about it that makes it stand out compared to other, you know, common cold, influenza, et cetera?
Sure, that's also a really good question, and I suppose there's two ways to describe it. One is what does the virus do to an individual patient who becomes infected, and then what does it sort of do on a community level? For the first part, what's the likely expected illness course of someone who becomes infected? It is still early to be able to describe that with precision, but by all accounts, it looks comparable to seasonal influenza. The mortality rate, meaning the number of people who become severely ill and require hospitalization, seems to be around 10%. The mortality rate, the number of people who succumb to the illness, tends to be less than 1%. And this mode of that it spreads from person to person also seems to be very comparable. It can be transmitted, like we just said, through casual contact, through sneezing, through surfaces. So in those regards, there's a lot of things that are similar to the spread of seasonal influenza and other respiratory viruses.
I would add
All right, thank you.
Yeah, I would add to that that we don't currently have a vaccine for this illness, and so that leaves fewer options for preventing the disease. With seasonal influenza that's circulating right now, we do have the flu shot that you can get, and we highly recommend that because that is an effective way to reduce the spread of influenza in our communities. At some point, it will be good to have a vaccine for this particular virus. As of now, we're left with the social distancing, the cough etiquette, you know, the avoiding going to work when you're ill, kind of preventative measures that are non-pharmaceutical in nature.
Thanks, Chuck. I think that's a really good information, a really good context when you talk about how severe it is. You know, we've had one case of COVID-19 in the state. We've had the number of influenza cases is approaching 20,000 now. So there really has been widespread transmission of influenza virus. What we really want to avoid is having an additional, a similar type of virus in terms of the severity and the spread, which is why so much attention has been paid to preventing the spread. So the influenza is a useful analogous, but the important thing is, yes, we do have a vaccine for influenza.
Okay, thank you. I want to remind you once again to use *6 to mute and unmute your phone, and make sure that your phones are muted, please, to preserve the quality of our audio. Thanks. We move on now to Stephen Cohn from WISC in Madison. Stephen?
Hi. Quick question, but what is the kind of status for that first patient or the one that has tested positive in Wisconsin?
What we're aware of is that the patient has done quite well. The symptoms resolved and remained in isolation throughout the course of illness.
Do you have a follow-up, Stephen?
Are they still in isolation at this point then? And is there a timeline to kind of let them re-enter, or is there a concern with that as well?
So the patient is still in isolation, and we have a protocol that we're following with CDC's guidance for how we will determine when someone can be released. It's just a matter of getting sufficient negative tests from the individual.
Got it. Cool. Thank you.
Mm-hmm.
Moving on to Stephanie Fryer, also from WISC. Stephanie Fryer from WISC. And a reminder to press *6 to mute and unmute your phones.
She accidentally sent it twice after I sent the original email. So.
Okay, we'll move on then. Thank you. Jennifer Cleasy from WKOW in Madison. Jennifer?
Hello, this is Jennifer. I was wondering if you could tell us, what kind of guidance you're going to be sharing with schools and workplaces about having the conversations over planning, to share information with the public without creating a panic at the same time.
So I can start with that, and others can follow. I think probably the most important message is for schools and school districts to be planning with their local health departments. Our local health departments have been planning, like we have, for many years, decades, to prepare for pandemic influenza. This is very similar in nature, and the planning that they've been doing is with their partners in these communities. And every community has their own roles and partners and players who are involved in that planning, and so it's really a case or a matter of picking up those exercises and plans that they've been working on and putting them into place. And so probably the main piece of information to share is to make sure that communication is happening. It's not too soon for it to be happening now. Your local health department folks are definitely busy with seasonal influenza, and the pivot to the messaging around this isn't that great, that significant. And so I would say having that conversation with local public health is the key.
Could you say who that was who just spoke?
I'm sorry, my name is Chuck Warzeka. I'm the Deputy Administrator for the Division of Public Health.
Thank you.
Sure.
Jennifer, did you have a
You
follow-up?
guys really need to identify yourselves when you speak, because we don't know who's speaking.
Very good, we will.
Could you just kind of describe, what might be an average response a district might need to be taking right now? I know you mentioned it was specific to different locations and what their communities have already worked on, but, is there a generalized recommendation?
Yes, thank you for that question, and I think probably something that we should have said early on. Among the ranges of things that we could act to do, we really aren't encouraging anyone to take any actions at this time, other than to make contact with your local health department, because that decision is based on a lot of factors in the community, and it depends on what the risks are for any of the activities that you'd be considering. Without transmission going on in the community, there really isn't a risk for those congregate activities. And so currently we don't have this illness being transmitted in our communities in Wisconsin, and so there isn't a call for taking an action. We know without having contact with local health departments, it's possible for people to feel they have to make the call on their own, and then we'll end up with a variety of different outcomes with that. And people do need to know that there is support for them, and that you do have resources, particularly with your local health department, and we're in contact with them regularly. They do fantastic work in this area, and I think the partnership with the school districts is pretty strong already in those cases. Does that help explain? And then if you have a follow-up question, maybe we can clarify.
Yeah, no, I think so. I just have one other question, if you don't mind, and then I'll let someone else get to it. But what about the airports? Are there any new recommendations there?
Currently there are no new recommendations about our airports in Wisconsin. This is Chuck Warzeka again, the Deputy Administrator for the Division of Public Health. There always are updates to the travel guidance on CDC's website, and I think it's very important to check in on that. If you're thinking about making travel plans, you're thinking about going someplace, particularly if it's international travel. This disease is not being transmitted widely in any part of the country of the U.S., but that potentially could change. And so keeping an eye on the travel guidance on the CDC website will be important. And that applies to academic institutions who are providing travel advice right now to their students who are preparing for spring breaks and things like that. Just be mindful of what's going on around the world and how much it could change, and plan accordingly.
Thank you, Jennifer. Moving on now to Ryan Lobenstein from NBC 15 in Madison. Ryan?
Yes, I'd just like to clarify a quote that I heard earlier, that the most important message is school and school districts to plan with their local public health departments for a pandemic influenza.
I would say the most important message is anyone who has questions about what they should do should be in contact with their local health department to work through guidance, because it's going to be very specific to what they're planning, what questions they have, and then thinking it forward. And our local health departments have been working very closely with us to stay current on guidance that we're providing and guidance that we're getting from the CDC, and we're trying to make sure that the answers that they have in front of them will help support you as best they can.
Was that Chuck again?
Yes, it was.
I apologize. Chuck Warzak, a Deputy Administrator for Public Health.
Ryan, did you have a follow-up?
I guess just to be absolutely clear, and that I don't misquote you, is that school and school districts should be working with public health in preparation for a potential pandemic of influenza.
Yes, Chuck Warzaka again. School and school districts should be planning with public health, but not taking action at this time because there is no community spread at this time.
Sure. This is Dr. Westergaard calling specifically from your quote, planning for a pandemic of influenza doesn't capture exactly what we're trying to say. A lot of the planning that has been put in place has been around the possibility that we will have a pandemic of influenza, of a novel influenza. So the planning that has been done, as Chuck mentioned, over the past decade has been sort of in that category. So the preparedness that now realize is that a pandemic of influenza or pandemic of a novel coronavirus are similar in that they are respiratory viruses spread in the same way. So what we've prepared to do outside of vaccination and medical treatment specifically is highly analogous. So the preparations that have been in place for pandemic flu are applicable here, and those are the discussions we should have, because at the end of the day, the main activity that's necessary to mitigate community spread of these kinds of infections are social distancing. It's getting people out of contact where an infected person can expose someone who's not infected. And that's true whether it's influenza or coronavirus or a wide range of other respiratory viruses. So that's the point, to make sure the quote has appropriate context.
Thank you, Dr. Westergaard, for that. Thanks.
All right, moving on to Mark Vittorio from Fox 6 in Milwaukee. Mark?
Yes, I'm looking to get the update on the ability for the state to do your own testing. I know last call we had, there was some issues validating those tests. Where do we stand right now?
So I don't think we have an update at this time. I know the state lab is still working on it with the CDC. We're very fortunate in this state to have one of the best state laboratories in the country, and so they are one of the early adopters of new testing methods, and so they're working on it, and they'll be ready as soon as CDC and they are ready to open up the test for us.
And the follow-up, I think, again, last time there were several other states who were having the same issue. Is that still the case with them as well, do you know, or it's kind of a group problem?
It's my understanding that it is a problem that is not specific to any one laboratory. It's a problem with disseminating this methodology and the materials, I think, that are used in the test. But to be more specific, I think we'd have to talk with the state lab, and this is, yes, Chuck Warzaka again. Thank you.
Thanks.
Moving on to Charles Benson from TMJ4 in Milwaukee. Charles? Charles Benson?
Hello.
Hi.
Hello. Hi, this is Charles. Thanks for taking my call. I have a local school district who has already sent a letter home with a message from the school district talking about having parents help with the monitoring of recently the outbreak of respiratory disease caused by the coronavirus that was first detected in Wuhan, telling parents, keep your children home until they are symptom-free. When your child is ill, report the symptoms to a physician and talk to your children about basic infection control. Is that a letter you want sent out at this point?
So our preference is that all school districts work closely with their local health department to craft any guidance that they're considering sending to parents. I don't think it's inappropriate to send guidance to parents, but we wanted to make sure that it's guidance consistent with the likelihood and the risk of people involved. And so I I won't speak to that specific letter because I don't have a copy of it, haven't seen it. We'll probably be looking into that, so thanks for bringing it up. But again, I do want to re-emphasize that close connection between the local health department and the schools, or anybody else who's considering taking an action or making a decision like that, will be really helpful in making sure that we are consistent about this and that we're using the best available information when we make those calls. Chuck Warzeka again from Public Health. Thank you.
So that's the balance here, right? How much information do you share? How much do you sort of provide guidance? That does it help people or does it add to the fear?
Right, and that's an excellent point, and I think that you'll find that the local health department is just as interested in helping achieve that balance as anyone else would be, and so I'd support that still as the path to take. There is a lot of information out there widely available on the website, and it's important that we also get that trusted, credible source, and we know our local health departments are an important source for information in their community.
One other follow-up on that, which you talked about, I think Jeff did, about preparing for what may come in the future. And the word quarantine has come up. So I'm sure the state has a specific pandemic plan and how to quarantine. Have any of those been revisited to see what would be needed if people have to be quarantined?
So Chuck Warzeka again, I'm going to pitch it to Jeff, but yes, we have been doing that.
So yes, this is Jeff. To answer your question, yes, the state does have a very specific pandemic influenza plan. We are currently in the process of reviewing it, looking at it. But really, I think, as Dr. Westergaard has pointed out, that the non-pharmaceutical interventions that we have been developing for many, many years in our pandemic planning is still very appropriate with the COVID-19. And that response of thinking about how do we handle the social distancing, how do we handle keeping people from home, thinking about telework and allowing people the opportunity to work remotely when they can is going to be critical, I think, in preventing the widespread of COVID-19 within the community.
Yeah, and if I could add Charles, I think to your other question about specific to our quarantine, is that we do have specific plans around quarantine, and that we've also use these tools more frequently, and local health departments use them related to tuberculosis as well. So it's an established practice in the public health community to use quarantine. Again, this is Chuck Warzeka with the Division of Public Health.
And then just one follow on that then, because we've seen on a national level that military bases have been used for some of the quarantines for coronavirus. Is Fort McCoy the location for that? And has there been any national request to use that military base?
So there has
potential future.
All right, Chuck Warzeka again. There has not been a national request for Wisconsin to serve as a quarantine isolation location for large group travelers, as you mentioned. We know that our National Guard is quite connected with us. They're up to speed on what's going on, and they do a lot of preparing and planning of their own in this area. So if called upon, they would have those capabilities. I won't say which specific resources would be in play. That's not our call.
Thank you.
Thank you, Charles. Moving on now to Mark Johnson from the Milwaukee Journal-Sentinel. Mark? Mark Johnson? Okay, we'll move on to Brian Kernan from WLUK.
Can you hear me?
Is this Mark?
Yes.
Yes, we can now.
Can you hear me?
Yes, we can. What's your question,
Okay.
Mark?
Sorry. I wanted to just clarify two numbers and then ask a question. I believe I heard 20,000 influenza cases. Is that Wisconsin for this season?
Yeah, the numbers get updated weekly. I think we can email you the most recent updated. The last week, I don't have the specific number, but it was closer to 17,000 And we'll be happy to provide the most point you to where our most recent numbers are as of on our website.
There was also a comment about the hospitalization rate being 10%, and I wasn't sure whether that was for coronavirus or influenza.
That was speaking about coronavirus. Again, that was a ballpark estimate. The World Health Organization has issued sort of the best available estimate, so we can also point you to if we want to correspond via email later.
Okay. And here's the question I wanted to ask. How many hospitals in the state are equipped with isolation wards that would be suitable if we had a coronavirus epidemic here?
We may not know that.
Yes, this is Jeff with the Preparedness Office. That number fluctuates periodically, so we don't have an actual exact total right now. But certainly we will put staff onto it and try to get an estimate and be able to share that information out during a future conference.
Okay.
So we did do some initial assessment with our healthcare partners when this was first going out, but none of us have that information with us currently. Chuck Warzeka again.
The number. If you're asking the number of hospitals, that's maybe in flux. The proportion of hospitals, I think we can safely say, is that all accredited hospitals, inpatient facilities, are required to have the potential to do negative airflow isolation, which is what the recommendation is, as well as to have the personal protective equipment on beds. So all Wisconsin hospitals should be able to safely care for someone provided that the level of care that they need is consistent with their resources from an infection control perspective.
Okay, thanks.
Thank you, Mark. Brian Kernan from WLUK in Green Bay. And a reminder to press *6 to mute and unmute your telephones. Brian?
Yep, sorry, I tried before. There we go. So what do you attribute the fact that Wisconsin has just had the one confirmed case so far and that it hasn't grown beyond that and the relatively low numbers of the 17 suspected cases?
Do you want to take this, Ryan?
Sure. So I mean, we can't sort of prove things with science, but I think the containment or the prevention activities related to travel restriction and which has happened at a national level, and some very robust local health department work, which means getting people identified quickly and efficiently and isolated. In each of the 14 cases of individuals that have been diagnosed in the country, that was very effective at reducing onward spread. In fact, there have only been 2 cases in the country that have been reported that were not acquired abroad and then in returning travels, and they were both close household contacts. So the recommendations of the standard public health measures of isolation seems to have been effective in that there's a very minimal number of onward transmission here in this country. So we think those are very sensible interventions when there's a new virus. Of course, the other reason is that this is a virus that initiated for the very first time in a specific area in the country, and the interventions were effective to stop it from spreading out to the globe. Up until this point, it has been.
Any follow-up, Brian?
No, thank you.
Thank you. Nicole Cohen of WBAY in Green Bay. Nicole? Once again, Nicole Cohen. And a reminder to press *6 to mute and unmute your phones. WBAY? Okay, moving on. And if you could remember to mute your phones when you're not asking a question, that will maintain our sound quality. Thank you. Moving on now to Jonathan Nizer of NBC 26 in Green Bay. Jonathan?
You bet. Early on in the call, before the questions, there was a little bit talked about for the fatality rate tied to
coronavirus, and I just wanted to get clarification on that because I've seen lots of different numbers reported elsewhere from as high as 9% and down 2%. So could somebody kind of address, how serious is this compared to the regular flu?
Sure. This is Ryan Westergaard. I believe the most up-to-date estimates, and I think we have to emphasize that they're estimates based on a situation that's evolving, were publicized yesterday by the World Health Organization Director General, who reported back on some of the preliminary findings of their team that went and evaluated data from China. And what they found, and this is on the website which you can share, was that while the initial estimates of the overall fatality rate was between 2 and 4% among the initial cases described in the Hubei province, overall, as more data has been accumulated, it seems to be closer to 0.7%. So those are on the World Health Organization website. The data are not summarized other than sort of as transcription from the Director General's remarks, but those are really the best estimates that we have right now.
Thank you.
All right. Moving on to Ed Walters from WFRB in Green Bay. Ed? Ed Walters from WFRB. And a reminder to press *6 to mute and unmute your telephones. Okay, we're going to move on to Rob Sussman from WTAQ News. Rob?
Yeah, I was wondering, there is a shortage of face masks being reported in several places throughout the United States, in fact, throughout the entire world. Do you anticipate issues with supply in regards to responding to this, to a potential outbreak?
Do you want to get that one, Jeff?
Sure. This is Jeff Phillips. Yes, we are monitoring right now globally the availability to get PPE, face masks, face shields, gowns, those types of things. There are certainly some issues with the supply chain having delays, mainly because a lot of the supplies actually do come from China. And so we're monitoring that supply chain, trying to figure out with our federal partners, CDC as well as some of the other federal agencies have been in contact with us talking about conservation and talking about finding options to find availability of other PPE. So yeah, we're aware of it, working on it, trying to at least come up with an answer for our medical providers.
With all that in mind, if you don't mind to follow up, how would you assess, honestly, the capability for health departments in the state of Wisconsin to impactfully respond to a potential outbreak of COVID-19?
Again, this is Jeff. I think that the key for the local health departments is certainly to work very closely with our Bureau of Communicable Disease and the DPH, as well as working with our staff and trying to, utilize the flow of information that's coming from the federal agencies and from the CDC, and sharing that information with the folks in their jurisdiction. We realize that local public health are the boots on the ground for us. They are the people that are implementing and working with the folks in their jurisdictions. And certainly we are very thankful for being able to work with the local health departments. But again, just making sure that they are looking at the social distancing, some of the information that is currently in their response planning, I think is going to be able to help us get to the point of preventing person-to-person transmission if that's possible.
And let me add that local health departments do this kind of work every day. They're always working to prevent and identify outbreaks in their communities. And again, this is Chuck Warzeka. Just wanted to make sure that people realize that this is not unusual work for them. It's work that they're doing every day behind the scenes, just not as visible as it would be in a situation like this. So I think we can all take confidence that this is a pattern that we work a lot with local health departments.
Thank you very much.
Thanks, Rob. Mike Kemeter from WHBY in Appleton. Mike?
Hi, I'll pass. Thank you.
All right, thank you. Tiffany Olson, WKBT in La Crosse.
Hi, actually I just have a question about wording. I'm still hearing media outlets say coronavirus, and now we're of course hearing COVID-19. What, are they interchangeable, or should we be switching completely over to saying COVID-19 at this point?
I think the disease caused by this new virus has been named COVID-19 by the World Health Organization, and that's sort of the language that's being used by CDC, and we're adapting this. This is Ryan Westergaard. So we're replacing documents in our language that previously used the word novel coronavirus to COVID-19 as the disease. If you want to get very technical, the international agency which names viruses specifically actually named the virus itself something else because it's so similar to the SARS virus that was from 2003 that they essentially call it SARS-CoV-2. So it's very similar enough that they said it's a sibling or a first cousin. So it's complicated. CDC is calling the disease COVID-19. And if you talk about the specific virus, if you're going to name it in the laboratory, it's either called the virus that causes COVID-19 or it's called SARS-CoV-2. I may have made it more confusing to you, but that's the latest sort of accepted nomenclature that's being used, and we're trying to use the term COVID-19 in our public-facing communications.
Okay, thank you.
Thank you, Tiffany. Emma Grosskopf from WXOW in Eau Claire. Emma? And a reminder again to press *6 to mute and unmute your telephone. We'll move on then to Todd Richmond from the Associated Press. Todd?
Yeah, I hear. Can you hear me?
Yes, we
can. You hear me?
Yes.
Do state officials believe you're getting enough funding and adequate communication from the federal government?
So excellent question. This is Chuck Warzeka with the Division of Public Health. We're working closely with the CDC right now in identifying what our current needs are and what additional resources we could use. I think it's all contingent upon how this virus goes and how transmission in communities goes. So there's a lot of planning going into right now estimating what the impact could take in terms of resources to respond to. We certainly have a range of answers to that question based on how this goes in the coming days and weeks.
Okay.
Yeah.
Anything else?
Did you have a follow-up?
Yeah, follow-up if possible. I'm hearing two different things here on preparation. On one hand, you're saying that the local health departments are taking the lead here. On the other, you say you're preparing plans for quarantines and social distancing, isolation. But this question has already been asked, but I didn't hear an answer. What kind of recommendations and guidance are you offering the locals? Yeah. You're the state that they'll be looking to for direction here. What are you telling them?
So in answer to your question, we have a weekly webinar that we work with local health departments or to present guidance and information to them on. We also receive questions from them and work with them on individual persons under investigation when that does take place. And so we have ongoing dialogue as well as global outreach. Our local health department partners have been working with us over the last 20 plus years on preparing for things like this. Their input and experience really drives the kind of guidance that we've developed and we make available back then to them as a community. So it's very much ongoing back and forth. And so the changes in guidance and the updates in guidance that we're doing currently are really to respond to what we're learning about this particular disease and how it might differ or how we might need to adapt the current planning that we already have in place with our local health department partners to address what those differences might be in this virus to those things the things that we planned for. So I'm not sure, did that answer your question? Again, Chuck Warzeka, Public Health.
Well, again, who's in control of the response in Wisconsin? Is it it you or is it the local health departments?
It's everyone working together. At the local level, there's no one who can manage and work on control of the individual outbreaks at the local level better than the local health department working with their local partners and healthcare systems. And at the state level, we work to support and coordinate and make sure that we have a coordinated response to an outbreak. Few outbreaks stay in one jurisdiction. And similarly, we also work very closely with our partners at the federal level. And then they would also say that they're in close conversation with their counterparts in other countries in the World Health Organization. So it really, it's no one person, it's a collaboration. There's leadership on specific outbreaks happens locally. And it's a public health system approach. Does that answer?
Thank you.
Thank you.
Right.
Thank you.
Mm-hmm.
Thank you, Todd. Shemaine Mills from Wisconsin Public Radio. Shemaine? Hi, you there?
Hi. Yes, thank you. I know you're saying the risk to the general population is low, but I'm wondering, are there any particular concerns for vulnerable populations? I'm thinking in particular those who are in nursing homes.
Dr. Westergaard, you want to
Sure,
take that?
sure. This is Ryan Westergaard calling. The risk, again, on an individual basis of developing severe illness as a result of the COVID-19 virus is certainly higher among people with medical comorbidities. So elderly folks who have sort of had the worst outcomes with this virus, which is the international experience. So that's generally true, that for this particular infection, older populations and people with pre-existing conditions seem to recover less readily. In terms of person-to-person spread, individuals in nursing homes and long care facilities, it is a different risk category, but we have very robust infection control systems in place that have also been developed and are in practice, not specifically in response to this infection, but to all infections that are spread through person-to-person surface contact or respiratory droplets. So there definitely are vulnerable populations, and the elderly is in that category. But we have systems in place for best practices in infection control to minimize those risks.
So this is This is Jeff again. I just wanted to tie in a little bit with Dr. Westergaard's comment that we are working very closely with the agencies that oversee assisted living facilities, elderly care facilities, those types of places, knowing that that's a vulnerable population. Again, the planning and the infection control practices and procedures that they have in place are what we're relying on, again, to prevent more COVID-19 morbidity in those populations.
Shemaine, do you have a follow-up?
No, thank you.
Okay. Rich Kramer from Wisconsin Public Radio. Rich? Okay. Moving on then to Raymond Newport of Wisconsin Radio News.
Raymond Newport, Wisconsin Radio Network.
Thank you.
As you've mentioned before, right now the state is much more concerned, I want to say, about influenza cases as opposed to COVID-19. Not to downplay the danger of COVID-19, but right now there's much more hazard to the public from novel influenza.
This is Ryan Westergaard, and yes, we agree with that assessment.
What should people be doing other than the normal isolation, the normal care for themselves if they do come down with anything? And again, what steps should be taken on an individual level?
This is Ryan again. The things that you mentioned are really the core. It's social distancing. So when people have a respiratory illness, and this includes the common cold as well as febrile illness, meaning what we call influenza-like illness, where people have respiratory symptoms such as shortness of breath and sore throat and sneezing with fever. The influenza virus can manifest in a wide range. So really any respiratory illness deserves to be treated as if it could be influenza or anything in that category. And in the usual practices that we recommend of staying home when you're sick, of having people who are close to you wash hands, clean surfaces, all of those things are really standard. The specific along the lines of the influenza epidemic, which we seems to be still have not yet peaked. We think in the coming weeks it might really reach its peak. And of course, we can't emphasize this enough. The main difference between influenza and coronavirus is that we have an effective vaccine. And so there's no shortage of influenza vaccine. Everyone is, all children and adults over 6 months are recommended to get it, and it's still available. About 40% of individuals in Wisconsin, by the data we collect, have been immunized, which means that 60% of Wisconsin residents could still benefit from getting an influenza vaccine, and it's not too late. So I appreciate you bringing up that question, because it's a message that we can't really say enough, that we still have the potential to save people's lives and prevent serious illness by scaling up our influenza vaccine.
This is Chuck Warzeka. If I could add to that, the previous question that talked about the availability of personal protective equipment is also influenced by the fact that we have a significant, severe flu season going on at the same time. And so to the extent that people are able to and do avail themselves of getting the flu shot, you're also helping your community and taking some of the burden off the healthcare system. And so we really strongly encourage that, because these two they're not the same illness, but they do have the same healthcare system that we're relying upon for dealing with the illness once the people are infected. So another good reason to think really hard about getting that flu shot if you haven't already.
Thank you, Raymond.
That was it. Thank you.
Thank you. Moving on now to Andy Moore from PBS Wisconsin. Andy? And a reminder, *6 to mute and unmute your phones. Also from PBS Wisconsin, Marissa Wojcik. Marissa? And also from PBS Wisconsin, Frederica Freiberg. Frederica, are you there? Okay, we'll move on then to Sandra Torngren from Spectrum News 1. Sandra, are you there?
Good afternoon, can you hear me?
Yes, we can.
Okay, so y'all are speaking on the flu pandemic plan. I'm wondering if we can have access to that.
So I'll say something general, and then maybe Jeff can chime in as well. Our pandemic influenza plan, this is Chuck Warzeka again from the Division of Public Health. Our pandemic influenza planning is actually a combination of plans, tools that are used, and exercises and planning activities and trainings that we do with our partners. And so it's a lot of resources. There is an overarching kind of plan, but what we're doing is we're taking the pieces from that broader plan and adapting those to be specific to this as we go, as we learn. So it's kind of a challenging thing to say this is the plan or this is the one thing, when it's a bunch of it's a toolkit. It's planning activities and exercises with our local partners and then within their communities as well. So in terms of giving you what we can, certainly we're able and willing to do that. But we're also pulling together additional resources every day to tailor to what we're learning about this specific disease. And so if Jeff or Ryan want to add to that.
Sure. Thanks, Chuck. This is Jeff. I think Chuck raises a good point that we do have a plan. It's a plan that's on paper. But really, that's not the meat of it, because as we have alluded to many times in this conversation, the key to making this all work is having boots on the ground at the local level, and really to have a state plan that talks about You know, when do we respond? When do we start providing guidance? When do we stand up an incident management system? Is just a very small piece of it. It really is predicated on our relationships with the local health departments, providing the training, providing staff competencies at the local level, providing the opportunity to exercise to make sure that we can, you know, utilize these plans effectively and efficiently and be able to meet the needs of those communities. So again, when we think about this from a full systems perspective, the state plan is a very small piece of it, and the 86 local and tribal health departments that are out there and their plans and how they integrate into their community is really what's important.
Thank you, Sandra.
Okay, one follow-up question, please?
Certainly.
I understand that if you have guidelines, I mean, we don't want your whole plan, but if you have guidelines in a document form, that would help us moving forward too, just so that we can plan ahead if need be. So if you do have something in a document form, can we get access to that, and how would we do so?
Again, this is Jeff. I can check for you, but I believe our pan flu plan, if it's not, it could be easily put onto the webpage. So we might just provide a link through the DHS website if that would be appropriate.
And
that would be just fine. Mm-hmm.
Okay, thank you, Sandra. And finally, Leah Bino from Fox 9 in Minnesota. Leah, are you there? Okay, with that, hello?
I can pass my time. Thank you.
Okay, thank you. And with that, we'll wrap up today's media briefing. We will have a video of it available for your use. Excuse me?
Oh, sorry. Hi. My name is Davey. I'm calling from the Journal-Sentinel, and I didn't have a chance to RSVP earlier. Can I just ask one quick question from Jeff?
Certainly.
So you mentioned, I cover higher education. You mentioned remote classes as one possible scenario at universities. I'm wondering if you could go into that a little bit more, and especially knowing that local health departments are probably in very close touch with them, given study abroad trips and researchers being abroad, and just this population that is, spending a lot of time in other countries.
Yeah, I appreciate the call. Thank you. Again, this is Jeff Phillips. Yes, we are working very closely with the local health departments, who are working very closely with the universities and the colleges within their jurisdictions. Certainly, we're working here very closely with the UW system and the information that's going out via UW directly to their students. So at this point, I think really we're kind of relying on the schools and the local health agencies to provide that guidance. And we're just kind of monitoring it to see that it's appropriate.
And this is Chuck with the Division of Public Health. I would add that Jeff just shared with me this morning some examples of some of that communication that's going on that really demonstrates a good level of coordination in developing those messages is happening at the local level. And so I would say that we're pleased with how that is working. Some of those remote classroom opportunities that Jeff mentioned have been used in the past, and I think that it's a helpful reminder for any students who currently are symptomatic with influenza, that if there are those options, we don't want them going back into the classroom and sharing that around. And so I think it's a good management technique that schools have been using and would be encouraged to continue using going forward. So thank you.
Okay, and could you put into perspective a little bit of like where the university seem to be falling? I know with the students at Platteville, that was kind of the first big concern in Wisconsin, and then the first patient ended up at UW-Madison Hospital. So are there, I guess, are universities particularly like a hotspot that you guys are focusing on in terms of communication, preparedness, or any particular, I guess, caveats that you're looking at when it comes to that area specifically?
So without, Chuck Warzeka again, without speaking to specific situations or any individuals, I would say that we do actually spend a lot of time thinking about who might be most at risk. And for this current concern, it's definitely travel related. And so certainly academic institutions where there is significant travel are folks that we've been working closely with, but other sectors as well. And so I would say that yeah, I think that, yeah, we have been focusing our energy around travel. Should this become something that is circulating in the community, similar to influenza, the advice is much more generalized then. It doesn't really, the travel information may be less important at that point. But we are following closely the CDC recommendations, the information they put on their website, sharing that with our clinical providers as well, so that they're able to ask those travel history questions and get a better understanding of what person's risk might be.
Okay, thank you.
Thank you. We're going to wrap it up now. We thank you for joining us today. We'll have a video of the briefing available for you later this afternoon. That will also include the names and spellings of the names of our experts who appeared today. Also a reminder to continue to monitor the DHS Outbreaks and Investigations page for updates on this investigation. It's updated Monday through Friday, every day at 2 o'clock. Thank you again, and have a good afternoon.